Hi everyone, I'm Kim Huelin. I'm a project support officer at Health Innovation West of England, where I support the Southwest Learning Disability Collaborative. But today I am going to be speaking from a personal perspective as Becky's sister. I wanted to share a glimpse into Becky's world and what healthcare means for her and our family. So meet Becky. Becky is my older sister. She has a severe learning disability and autism, and she needs support with most aspects of daily life. Her world is built around her routine and the small, simple things that she enjoys. So, as a family, we work hard to try and weave these things into her day to day life. So, I thought I'd give you a little glimpse into Becky's world just so you can have a better understanding of who she is and what matters to her, really. So, as you can see, Becky's week is very structured, just as she likes it. But I'll pick out a few highlights from this schedule. So we've got cooking, singing, listening to music, playing games at the day centre that she goes to a few days a week. We've got a cinema night and a cinema afternoon at home in there where she watches Sonic and Paddington with my parents. But the activity or event that is probably Becky's biggest joy and really what her world revolves around is our family shows, as she likes to call them. And these are basically little gigs that she puts on with the help of the family for all of our siblings' birthdays. And we play songs from whatever band or artist she's obsessed with at the time. So that's why she's dressed up like Elton John in this photo. We did an Elton John show. And yeah, because we have a big family, these shows end up happening pretty often. So she's always planning, preparing, and talking about her shows. So these routines and activities, they shape her world and they give her structure, comfort, and bring her a lot of happiness. So for Becky, health isn't something that she actively thinks about. If it sits outside that structured routine, it's unlikely that it's something that phases her. And so, because of that, my mum, as her primary carer, manages all of her healthcare from arranging appointments, interpreting guidance, and making decisions on Becky's behalf. This responsibility, it can be complex and stressful because every decision has to balance Becky's comfort, her dignity, and well-being. So for our family, health is definitely a shared responsibility and not something that Becky can navigate alone. So cervical screening is an example of how challenging healthcare decisions can be. Becky receives routine invitations, but really no one has ever sat down with us or my mum as her primary carer to talk about whether this is something that she should have given her circumstances. Um, as a family, we know Becky's world. We know what she understands and what she doesn't. And so we know that this procedure would be deeply confusing and potentially distressing for her. And what makes it harder is the inconsistent advice out there. So one person will say one thing, someone else says another, and we are left trying to piece together what the safest and kindest option actually is. And that responsibility does ultimately sit with my mum as her primary carer. She carries that emotional weight of having to make these decisions, what's always trying to do what's right for Becky. So I think our experience really shows how families can end up navigating quite complex healthcare choices on their own, even when everyone involved is genuinely wanting the best outcome. So, why does this matter? I think that Becky's experience shows that when we talk about improving screening uptake for people with a learning disability, it's obviously not just about sending reminders, it's about recognizing that healthcare looks and feels very different depending on the person. Services can only really work when they understand the individual's world and meets them where they are. When that doesn't happen, things that are more straightforward, perhaps for most people, can become distressing or even traumatic. And family and carers, people like my mum, they often carry a huge emotional burden trying to interpret this mixed advice and again, make the safest, kindest decisions. So ultimately, accessible and compassionate services need to support both the individual and the people who care for them, because that's what really makes a difference. So thank you very much. That was Becky's story, her experience, her world. I really appreciate you listening. And I'll now hand over to our next speaker.
So, hi all, I'm Lisa Harrison. So I'm a screening and immunisation coordinator with the Southwest Vaccination and Screening team. And as noted earlier, so unfortunately, Emily, who's done so much work in this area, isn't able to come today. So I'll try to answer any questions as they come in the chat. But please feel free. We've got a slide with our contact details as well, so you can always contact us via there as well. Okay, if we go on to the next slide, please. Thank you. So this is just a quick slide explaining who we are as a team. So in the national guidance, unfortunately, we're often referred to as the SIT. So that was our previous name, so Screening Immunisation Team. But essentially, if you see SIT, think that's ourselves. So we commission all of the routine under the Section 7A screening and immunisation programmes. So that includes all of the cancer screening programmes, non-cancer screening programmes, and the national immunisation programmes as well. And as part of that commissioning, so we always want to really focus on whether our providers are giving that, are improving their uptake, but also addressing health inequities as well. So that inequity to accessing healthcare. But we've just got a few more points on there, what our team is, but just for time, we'll go on to the next slide. So you can see here, as part of our work, we collaborate with a lot of different groups. So within NHS England, but also outside, within UXA, who look at things more on a reactive basis, so for outbreaks and things like this. With OHID as well, and with our cancer alliances and learning disability teams as well. That's also on here. I think we don't have our third sector organisations as well, so we also work with them as part of our overall team. If we go on to the next slide, please. Thank you. You likely all know this already, but just wanted to a very brief overview on the screening programmes in NHS England. So essentially, screening is looking at how we can identify people who are apparently healthy, so don't have any current symptoms, but they may be at that increased risk of disease or condition that they might not be aware of. So having this screen means that then you can go on to afterwards, seeing if there are any further tests that need to happen for a possible diagnosis, possible treatment that might be needed, advice and support, or it might be that actually there's no further action that needs to be taken, there's no diagnosis that comes from that possible increased risk. So essentially just want to confirm here, screening, it's not a diagnostic test. I think often people think that that's the case, but I think this image really nicely shows it's more of a sieve to try and pick out the overall population in England, who are those who have those high risk, who might have that possible high risk of the disease or condition being screened for, and so then they can go on to see about getting earlier diagnosis, earlier treatment than they might have if they had waited to develop any symptoms. So just to confirm that. If we go on to the next slide, please. Thank you. So here we've just noted the overall screening programmes for adults in the UK. So we've got the breast cancer screening programme, the bowel cancer screening programme, cervical screening, which we're going to talk a little bit more in depth today, the abdominal aortic aneurysm screening programme. So just noting, this is one programme that's only for men. And the cervical screening programme is for women, but also for people with a cervix who may not identify as women as well. And then we have the diabetic eye screening programme as well. So we've just noted here, so the eligible cohorts and the current recall period as well, just for your reference, but we won't talk too much further in depth. If we go on to the next slide, thank you. So I think here already, as outlined in the previous two speakers, thank you very much for that. So just noting, as I'm sure you'll all know, we know that there are inequities for people with learning disabilities and or autism, and with not being able to access healthcare as readily or feeling underserved, we know that that leads to poorer health outcomes, unfortunately, a shorter life expectancy, and so greater health inequalities. So when we're looking at screening, we want to try and reduce this as much as possible to reduce those health inequalities that are experienced. If we go on to the next slide, please. And here we've just got a very clear example that's seen in cervical screening. So in the dark blue bar, we have there people with learning disability, and then we have without learning disability in the brighter blue bar. And that's showing the levels of uptake in the last few years of cervical screening. So we can see really clearly much lower coverage for people with learning disabilities. And so with that, then we know that people are not accessing possible earlier treatments, and so that would lead to possible not as positive health outcomes. So this is where we really want to be improving cervical screening as much as possible for people with learning disabilities. If we go on to the next slide, please. Thank you. So as general, so this is largely very applicable across the screening programs, but we're focusing on cervical screening just because it has more relevance for people who are working in primary care. But across the board, we want to be understanding our population that we're serving and knowing what are the barriers that they're facing. So that is to help to address their needs. That's very specific. So say to your area, for the people that you're serving, but also to the individuals, because everybody will have slightly different needs. And being able to access those individual needs means that you're supporting that faster diagnosis of any screen cancers to achieve those better health outcomes. So in the next few slides, we've tried to note some various different barriers that people may be facing, but it's to note this is not the exhaustive list. There'll be many more, but we're just trying to get quite a few of them here. So we've looked at it based on individuals and then structural barriers. So individuals looking at it from the patient's perspective. So we know that there might be a lack of knowledge about screening, about why it's needed, especially, so as noted before, with Becky stating, you know, health is only if you have a symptom, if you're feeling ill. So these are kind of things that are one of the barriers that we can have. Also just on general communication. So, you know, are we making sure that people are able to understand screening in their own language, in things that can support their communication as well. Across the population in general as well, we know that there's a lot of fear, stress and anxiety around cervical screening. So this can be a really big barrier. And some of those social norms around cervical screening as well, that can be a really big barrier with this. And then just a lack of previous experience or a previous positive experience. And then hearing things from friends and family can be a real big barrier, as we know. In terms of structural, so this is looking at it more from the healthcare provider point of view. So there can be that lack of awareness of people's eligibility for screening, cervical screening, especially for people with learning disabilities. There can be a bit of fear or anxiety around supporting people about, do they have the right resources available, knowing what is available first off as well. And looking at the physical environment, is it accessible for a person who may have mobility? They may need further support with their mobility. And we're going to talk a bit more later about inappropriate ceasing from the cervical screening programme. And then we know as well what can be a really large issue is the ability to flag on the system, on the general practice system, for that a person has a learning disability, and does that pick up correctly with their invitations and things. And we'll go on to the next slide then. So what are some practical things that can work? We're going to talk about this much more in the next few slides as well, but just in general, what we know is reasonable adjustments is a really positive thing for individuals. And this looking at that on that, you can look at it from the population basis, but also for your individuals as well. So we know easy read materials can be really supportive. sharing information, so with the individuals but also with their families and carers to support those making best interest decisions. Having familiarisation visits, so visiting, say for cervical screening, so you go to the actual room where you may have your screen, you can see the, the speculum that is going to be used, talk through that, see the brush that's going to be used, just to really set up those expectations of exactly what is going to happen and when, and give some, just practical tips. Say, for example, wearing a skirt is much easier and more comfortable for a person coming in. So just those little kind of things that helps to support somebody know exactly what's going to happen and when it's going to happen. If we go on to the next slide. So just looking at overall the work that our team has done, and I'm going to put full props to Emily here because she's done an incredible amount of work. So she's in general been raising the profile of learning disabilities and screening, so through various networks, webinars like today, and health inequality days and stalls. We also do have training available. I've just popped in the chat, I think earlier, on our NHS Futures site, so please feel free to look there. We try and put national evidence that's already been shared, but also our own best practice guides that we've created. So we have created a cervical screening toolkit for people with learning disabilities. I think I saw Joanne Pike earlier from Cornwall, who her team were really great at collaborating to create that pack as well. That was based on a lot of their work already. So just want to give a quick shout out there. And we also have an inclusion checklist and a screening flowchart. So that can just be seen on this side, giving various tips on what can be done throughout screening to support somebody with learning disabilities. And then we'll just go on to the next slide. So this is a large piece of work that Emily's been doing. So this was the commissioning of learning disability screening practitioners. You're going to hear from one a bit after my speaking as well. So this began in 22-23, and it was commissioning 6 learning disability screening practitioners across the Southwest. So as just mentioned, there was already a very well-established team in Cornwall. So currently we now have 5 posts in Devon, Somerset, Dorset, BNSSG and Gloucestershire, and then BSW that's currently being put in place. And this is all to support people with learning disabilities to access and make that informed decision about the 5 adult screening programmes. Some might be doing this directly with patients and some are doing this more strategically, so reviewing particular areas or particular providers that they can support with supporting their population. Okay, we'll go on to the next slide. Yeah, so just here we've got some contact details. Any further questions that you might have, please feel free to come to us, or I think as well you can send to this group as well, and then they can send us on any questions. We're just highlighting that here. So we'll go on to the next slide. So this is looking more specifically at that cervical screening pack. So lots more details are within that pack if you want to see, but we'll just route a few of the main things here. Just looking at cervical screening, so this is really trying to support that early detection and treatment of cervical cancer. So screening is where we're looking at we're trying to find those high risk subtypes of HPV, so that's human papillomavirus. And this is because high risk HPV is linked to the abnormal development of cells which can cause cervical cancer. And that's the reason for the change from saying cervical screening. It used to be cervical smear. But as we know, some people have, it's been noted that people with learning disabilities might be easier to explain that it's a smear because that's what's locally known, what their friends and families might call it as well. But just clinically for ourselves, we call it a cervical screen. So just to note, so this is available for anybody with a cervix, aged 25 to 64 years old. The intervals you might have seen have just recently changed. So now it's 5 yearly intervals for 25 and 49-year-olds, as well as 50 to 64-year-olds. Just noting that slight change. And then people who aren't eligible, it's generally for those who are under the age of 24 and a half years old. Okay. We'll go on to next. So when looking at how can we improve the access and improve the uptake within your specific service, we really want to be thinking about what is your population looking like. So what is the age and ethnicities of people that are represented? How many people have a learning disability flag on your GP records? Are these accurate as well? How many different languages are spoken? And are there any other demographics you might need to make a note of? And then how do those different populations intersect together as well? And this is where we really want to be looking at people's individual needs. And then we want to be considering, so what are the current number of people who are attending cervical screening? And then those who are overdue their cervical screening as well, or haven't attended despite multiple invites, what are things that can be done to support that particular group? And then of these, how many do you know who have a learning disability as well? If we go on to the next slide. Thank you. So there's a real large amount of training that's already available, and we've just noted here a few things to just particularly note. So we want to make sure that all screening sample takers are up to date with their training, but also making sure that they're up to date with how to make those reasonable adjustments. And we'll talk through a few more of those specific ones in just a moment. And I think it's really important making sure that reception staff are able to have these conversations as well, as often they're, trying to sort out different appointments and things, but making sure that they're having that conversation, knowing who's eligible and what reasonable adjustments can also be made for as well. And we've noted just in terms of general learning and development, people can have educational sessions as part of protected learning time. We've provided in our pack some practical scenarios that could be used as part of that. It looks at various different things. We'll talk about that in a bit in a moment, but we look at various different scenarios and what are some of the top tips that could be done to improve the scenario that's given. Could be budding up with another surgeries as well to help to improve access to cervical screening, trying to discuss what they found worked, what hasn't. So just trying to give some practical tips there. If we go on to the next slide, please. Thank you. So this is looking at overall what can be done. So firstly, we want to make sure that people have a positive experience from their first experience and every time that they engage in cervical screening. So we know that people already come into cervical screening with quite a lot of fear, quite a lot of anxiety. They might have heard things from friends and family, which might have changed their view, or it might be that they could hear from friends and family a really positive experience. That's what we want to be making sure everybody is experiencing a positive experience when coming in for cervical screening, trying to reduce that fear and anxiety around it. When making that informed choice, we want to be making sure so a person knows why they're being offered screening, what happens during the test, the benefits and the risks of screening, the potential outcomes, and what happens to their screening records. So as part of that, that's where we want to be using. So we've got this easy read guide here. That's really helpful, just making sure that people know exactly what's going to happen and why they're being invited. There's also lots of videos out there that can be used to help with making that informed choice. So there's a wealth of different resources. And I think that was really highlighted before by the example from Becky of being able to share that information about what screening is and then making that choice with family members as well as needed. So as part of this, we need to be supporting people's education, their communication and their understanding of the cervical screening programme. So that can be making sure that you know what a person's individual communication strategies are. So it could be using Makaton, it could be using a picture exchange communication system. So they're needing to have that conversation about what's specific to that individual. So as we've noted, using our easy read guides as well, which are available, lots of videos, which I think we'll be looking at later as well, and if any translated materials are needed as well. And then looking at what targeted resources or interventions could be used. So this is where having those conversations with the individuals on how they want to be communicated, where is best to share the message, and what do people need to know, and what do people want to know. So also, if you were looking at it from a population point of view, you might want to engage with local charities that you know of, or just local community groups as well, and that could be a really targeted way of having these conversations. If we go on to the next slide, please. So the next few slides, a lot of information on here. We are sharing the slides, so appreciate a lot, very wordy. I won't go through everything here, but it's just noting here are some really practical, reasonable adjustments that can be made. So we've talked about having those longer appointment times, but also those familiarization visits as well, just to help people really understand what is going to happen when. I know one practice has made a video to show a person, what will happen when they come in, they go to reception, they go to the room, and it's just a really nice way of visualizing that aspect. Looking as well if anybody needs physical support. So we've got just further information on what that might be there. And is there a way of reviewing the consultation room to make it as welcoming as possible? It might be looking at, can we reduce the amount of noise? Is there a way of making it more a private space? And when we've noted here on the drop-in clinic, that's what can help with that if it's outside of working hours. So say after 5 p.m, that can be a quieter, more private time to come for cervical screening. And that can also support with so carers, family, or the people themselves, if they're working, then that can also support with their accessibility to cervical screening. If you go on to the next slide. Thank you. So here we've tried to put some of these various practical tips in different sections. So essentially just trying to know all the different things that we can consider as reasonable adjustments. So you can see there's a really large breadth. Again, this isn't that exhaustive list. I just want to note here, I think it's something that we can sometimes forget about a bit, but it's just noting that there's ways during the appointment as well we can support with checking people's compliance with having their cervical screen, because it might be you need to check with them beforehand what behaviour is usual for them. What is a way that you could communicate that they no longer want to carry on with the screening, because that's absolutely fine to do. So it might just be pressing somebody's hand is like, that's my no, I can't continue, and then looking at maybe at another time could do cervical screening then. And then also I think on communication can be really important thing to consider as well. So just trying to use really short, clear sentences, as little repetition as possible, and using those 3-word sentences so it's very clear, short, and just helps to make everything quite understandable of what's happening. Okay, if we go on to the next slide, please. So here as well is just some further tips that can be looked at. So just reviewing our invitation letter. Is it, does it have all of the information that's needed for somebody to understand what goes into cervical screening and what will be expected of them for that response? On the checks, prompts and reminders, so making sure that we're checking the learning disability register is up to date for all patients. Is it up to date on the cervical screening management service as well? And looking at previous previous screens that a person might have had, or any follow-up for non-responders as well. You might want to use different awareness campaigns that there are. So we've got the Cervical Cancer Prevention Week in January. That could be a time to really promote cervical screening in the service. We're also looking at the Awareness Week in June as well. And then, as we talked about, so some of that data cleansing, making sure that you're getting rid of any ghost patients in the service, but then also making sure that you've got that learning disability register up to date. And just noting here, so some additional considerations for people with autism as well could be on, so in relation to with cervical screening, that there is a higher likelihood of somebody identifying as transgender or gender diverse if they have autism. So just making sure that you have that understanding of their eligibility for cervical screening as well. There is further national information on that as well. Okay, we'll go on to the next slide. Thank you. So now I'm just going to close on thinking about so deferring and ceasing from the cervical screening programme, because there is a lot of confusion about this sometimes. So essentially, the programme invites our eligible population at standard intervals. So as we discussed, it's now 5 yearly for all individuals. So we have a call and recall system. So that's operated by the cervical screening management system, and looks at that invitation process, making sure that people are invited at the correct time. So sometimes a person might need to be deferred or ceased from the programme for whatever reason. Deferring is when somebody for a specific amount of time is not given their invitation, essentially. So that is decided by the healthcare professionals for that individual. And that is only for that specific period, whereas ceasing is where, say, a person chooses to withdraw from the programme and then they're no longer eligible. So they would be removed from the call and recall. So they'll no longer receive those invitations. But there has been an issue in the past for people with learning disabilities. And I think the most important thing to note is that a physical condition, a learning disability, is not a valid reason for ceasing any person. So we really want to promote that with the reasonable adjustments discussed, that it means that screening can be achievable for some people, and that you need that adequate support and preparation, and also that communication that we've talked about as well. We'd always want, so with each, so now on that 5-yearly basis, when a person receives their invitation, that should be an opportunity to really discuss through, is screening appropriate for this person at this time or not, and then make that an informed decision at each time you get that invite. So that's why we'd always want to encourage people to remain on the call and recall system to receive those regular invitations. So we'll just go on to the next slide. Just noting in the slide set that you'll receive, we've got a few hidden slides there, just because we don't have the time to talk through them today, but hopefully that's got a lot more information on ceasing and deferring as well for a patient. So just to note, so this is one of the scenarios that we've used in our cervical screening pack. It's just used as a way of having a discussion around various different scenarios that we know of, but it's completely fictional people, fictional scenarios, so just making that really clear. But if we go on to the next slide, I just want to look at more the learning that comes from it. So this was for a person who had a learning difficulty. They were told that they were their previous practice had ceased them from the programme. They went to an organisation who said that actually they are still eligible, and had that conversation with them to be able to have a cervical screen. So just noting some of the learning from this. So that original practice should have gained Kate's informed consent, or with her family members as well, on whether screening is appropriate for them or not before ceasing them from the programme. And ideally, they should have been kept on the call and recall system to be able to have that conversation at each invitation. They should have referred to the national guidance on this as well, so that's linked there. And making sure that all staff are aware of. So in this scenario, it may have come from reception staff. We know that have happened in the past. It may have come from the cervical screener, or it could have come from a GP. So just making sure that all staff know that a person having a learning disability is not a valid reason for ceasing from the programme. And they're just noting that being on that call and recall really allows for that time at each time they're invited to explore what can be done to support them in either accessing cervical screening, or just furthering their information about screening for their informed consent. Okay. I think now I'll be handing over onto Lynn. Oh, just noting here, these are the further examples as well on that slide.
Thank you, Lisa. Really interesting. Yeah. So my name's Lynn. I am the Learning Disability Screening Practitioner for Bristol, North Somerset and South Gloucestershire. So I'm just going to talk a little bit today about my role and some case studies that of people that I've worked with over the last 2 years that I've been in my role. So when I started my role, the vaccination screening team gave me the aim to increase the uptake of cervical, breast, bowel, AAA and diabetic eye screening for people with a learning disability in my footprint. So that's the adult national screening programmes. So I work with people with a learning disability. So I offer regular training to them about health screening to give them information so they can make an informed decision about going for screening. So I've noticed in the chat there's somebody else has used some dummy or anatomical models to model screening, and that's a lot of the stuff that I do. So I take the anatomical models of breasts and of the cervixes. I also have some testicular models so we can teach about self-examination. And I visit care homes, day centres, any kind of setting really in Bristol, North Somerset and South Gloss, and teach people about their bodies so we can empower them to make informed decisions. I also talk to their carers and do a lot of education with carers so that the carers can then talk to the people that they support about screening. Also a lot of signposting to local screening programmes and primary care to encourage the support workers and to empower the support workers to request reasonable adjustments for the people that they support. And then also I support primary care and the screening programmes as well to highlight health inequalities, promote the use of reasonable adjustments and offer specialist knowledge, advice and guidance in my role as a learning disability nurse. So if there are any practices, primary care colleagues from Bristol or Somerset and South Gloucestershire in this call, then feel free to contact me afterwards and we can have a discussion about how I can support your practice to increase the uptake for people with a learning disability in your area. So next slide, please, Kim. So as I say, I've just got a few case studies, and the first one is about breast screening. So these are all real people that I've supported over the past couple of years, and hopefully you'll see our role that we are doing in the Southwest, and also the importance of adjustments in cancer screening care. So this was a 57-year-old woman with a learning disability. She'd never been to breast screening before, and she lives in a residential care home in Bristol. So I visited her twice. The first appointment was to meet her, to gain a rapport with her, to kind of assess her communication. And then the second visit was to take lots of accessible resources. So there's a really good video that the Bath Complex Care team made with the Avon breast screening team. And it shows somebody having a mammogram done. So I showed this video to her. I took some easy read leaflets and I took lots of pictures. And I also used the anatomical breast model so I could model what having a mammogram would kind of look like, and she could see that on kind of the breast model. I facilitated a pre-visit, a familiarisation visit to the Avon breast screening unit, so she could have a look around, she could meet the staff, she could have a look at the mammogram machine, and just kind of get used to what the environment is like. So we then booked her an appointment, and that mammogram was successful, but further investigation was required. She later required a biopsy under sedation, and she was diagnosed with breast cancer. She's now receiving treatment. So it just goes to show, so as Alison said earlier, people with a learning disability are often diagnosed later on, and also this lady was a black woman, and they're more likely to be diagnosed with later stage cancers compared to white women. So if we hadn't have supported this lady to go, then who knows what the outcome would have been later on down the line. So the importance of desensitization was really important here, so that she could see what was going to happen to her. She could have a look around the unit, giving her the information so she could understand what was going to happen overall to reduce the health inequalities for this person. So next slide, please. So next case study is a gentleman I supported with bowel screening. He was a 69-year-old gentleman. He had a learning disability and he was autistic, and he had never completed bowel screening. So this gentleman lived with his sister, but they were kind of led separate lives. He was very independent, going out every day, and she kind of did her own thing too. So I met this gentleman at his day centre, and I identified the barriers straight away. He told me that he didn't know what the bowel screening kit was for when it came through the post. He didn't want to send his DNA through the post. He thought it was a bit weird. He thought it was some kind of conspiracy that, you know, he was sending his DNA away. And also he didn't know how to collect a fecal sample. So he said to me, do I have to poo on the floor? So there were lots of barriers that I identified. So I spent quite a lot of time with him to explain the bowel screening kit, why it's offered, what it is, what it tells us, where it goes. And I used a demonstration kit, and I used Play-Doh as poo, and I showed him how to complete the kit by himself. And I also used some accessible resources. So I gave him the Easy Read leaflet, and there's also a really good video by Health and Hull, which I use quite often, which sets out really clearly on how to get that poo sample. So he went away, and he rang me a few days later to inform that he'd successfully completed it, and he sent it off in the post, and he said it was easy and it was fine. And then he rang me a few weeks later and he said the results are fine, I've got a negative result, and I will be able to do this in 2 years' time, so I won't need your support anymore. So in promoting kind of choice, inclusion, in ensuring that he was participating in what we were doing it together. I really empowered him to make a decision about whether he should be doing the bowel screening kit or not. I improved his health literacy, so he knew. I also told him about the red flags of bowel cancer, so he knew to look for blood in his poo in the future, and all sorts of other things to reduce health inequalities, to make sure that he was supported in that remit in the future. Okay, next slide, please. So I've got a case study about cervical screening. So this lady I'm still working with at the moment, so we haven't actually got an outcome for her. But she's a 46-year-old woman with a learning disability. She lives alone with support, and her support workers are visiting her daily. So we had a referral to us. So there's an acronym here. The ALDHS is the Adult Learning Disability Health Team. That's the CLDT. It's what we call the CLDT in Bristol. So we had a referral from the GP requesting support for cervical screening. She tried it in the past, but it was unsuccessful. So I visited her at home. And as soon as I arrived and I had my bag of kit and I had my bag of, my model cervixes and my speculums, as soon as I got the speculum out the bag, she visibly recoiled, and it was really obvious to me that she had quite a big fear of speculums. So we had a big discussion around this, and then we also had a discussion of what could help her attend a cervical screen in the future. So together we identified what adjustments she might need. So I left her a small speculum in her house so she could be around it, touch it, have it in her house, just kind of have it around, so she could familiarize herself with that piece of kit. We requested an appointment on a specific time of day and a date when she had support. She had access to a pets as therapy dog, so we asked the GP surgery if a therapy dog could come with her, and they said yes. They were very accommodating. And we also asked for a longer appointment. So her appointment is due in December. This isn't an end date, so if she doesn't want to go on that particular December morning that she's requested, then we can try another day. There's no, we can just keep supporting her over time to attend. Again, promoting choice, so giving her the choice of what adjustments she might need is really handy and helpful. Promoting independence, inclusion, and having her participate in the discussions is really, really helpful. Again, improving health literacy and overall reducing health inequalities. So next slide, please. So the last case study I'm going to present on is a gentleman I supported with AAA screening. So this is a 65-year-old man who lived in a residential care home. The AAA screening program coordinator contacted me to inform that he hadn't attended his appointment. He just didn't turn up. So I called the care home, and the manager of the care home said that this gentleman didn't currently have a wheelchair suitable for use in the community, so we couldn't go out. The physios in our CLDT already knew about this issue, so it was already being, he had support for his wheelchair. But I spoke to the physio, who gave me verbal advice about what to say to the care home, and then I relayed back to the care home, and I think that set things in motion a bit quicker than they would have if I hadn't have been involved. The care home advised me when the wheelchair was fixed and he was able to leave his house for appointments, and then I was able to tell the AAA screening team to book an appointment, and then he successfully had his AAA screen. This is just one example of improving something in somebody's life in a holistic way, which has impacts throughout his whole life. So he could then go to his health appointments, he could then go shopping, he could then go to his day centres, he could, do all sorts of things. But if it wasn't for me kind of nudging the physio and then nudging their care home team, it might have taken a bit longer for him to have all these things done. There was a bit of MDT working involved, and it's just important to get over these barriers so that he then could attend his AAA screening appointment to reduce health inequalities. Okay, next slide, please. So in terms of diabetic eye screening, I just wanted to highlight a couple of resources that you could use if somebody has a learning disability and wanted some accessible information. So there's the really good diabetic eye screening storyboard or social story by InHealth. The link is below that image there, and you will get these slides. And then there's the Diabetic Eye Screening Easy Read Guide by NHS England, which is also really helpful. Okay, next slide, please. So I've just got some kind of my top tips for screening for primary care. This is mainly aimed at. So if we code patients with a learning disability correctly, they can be offered reasonable adjustments for screening. And there is some guidance on coding and identification. Yeah, if they're flagged as having a learning disability, then we know that that person will probably, not always, but need some kind of adjustment to help them attend. You can share information with the screening programs. This comes under direct patient care under the GMC guidance. So if you get a request in from the screening programs, you can give them patient details. Really important to discuss screening during annual health checks and to record these discussions. So studies have shown that GP endorsement or a healthcare professional endorsement can affect that person's willingness to attend that appointment. So if you're endorsing screening, then that can really help. Think about reasonable adjustments, which we've all talked about today. Follow the Mental Capacity Act and record all decisions that you're making. And if you're struggling with supporting somebody to attend, ask your local learning disabilities screening practitioner or your CLDT for advice, and they can give you information about the Mental Capacity Act or to support somebody who is reluctant to attend or who is not responding. Next slide, please. So I don't expect you to read all of this. This is a lot of information, but this is lots of easy read information, books beyond words and videos about the adult screening programs in England. So yeah, it will be sent to you. And next slide. So we have some screening videos. So I know that Greater Manchester have just come out with this amazing suite of cervical screening videos. So we've done very similar in our down in the southwest. And I think Kim, if you could share those little snippets of our cervical screening video, that would be great.
Get them up now.
Thank you.
Another cup of tea, thank you.
You're very welcome.
Everything okay?
I just received this letter. I don't know what it is about.
Oh, let me have a look. I've had one of these before. You've been invited to have a cervical screening test.
A what?
A cervical screening test is a test that could save your life. I always have mine when I am invited.
I'm glad that you know about the test.
The test is done by a nurse who checks the cervix, which is an area inside the vagina.
Oh.
They are sometimes called smear tests. I was worried about my first one, but it all turned out okay.
It sounds embarrassing. So do I need to have one?
Oh, the nurses who do the tests were very nice to me and made me feel very comfortable when I had mine done. The choice is yours, but it is important, so I think you should get it done.
I was embarrassed first,
but when I get there, I was fine.
It's a really good test as it can help prevent cervical cancer.
Really?
It checks to see if you have HPV. If you do, you can have checks to see that you don't get cancer.
What is HPV?
HPV is simply an infection that is passed through skin-to-skin contact.
Thanks, Kim, for sharing that. Yeah, so that's just a little taster of our video. We've also got a AAA screening video as well. So please do share and have a little look. The cervical screening video, I think it's 17 minutes long, but we've clumped it into shorter segments. And then one final thing on the end of my slides, there's some contact details for the screening practitioners in your areas. And that's it from me. I'm going to hand back over to Alison.
Thanks very much indeed, Lynn. That was fantastic. And thank you for the brief clip. It's really helpful to see some of the videos, and it's interesting. There are so many different resources available. For everybody who's joining here, we're going to share the presentations, and we're also going to share briefer clips so you can look at specific parts, specific talks, and we are going to share some of the resources, the video clips that have been shared. We also wanted to make you aware of other resources. So some what we had shared with us on male breast cancer, and then the next slide is on from Copperfield, which I didn't really know about. I'd heard of it, but I didn't realise they'd worked with Thera, which is an organisation in Leeds, and they've developed resources on screening, on testicular screening and breast screening. So again, lots of things that are out there to help. So we will share the slides with the links. Hopefully you'll have a lot of links afterwards. As I've put in the chat, and thank you for Kim, if you're able to feedback any ideas, how you think this works, ideas for the future, that would be really helpful. Next slide, please. We're also, it's worth joining the Learning Disability Collaborative, and also if you're interested and you want to know about the regional newsletter, which is I find incredibly helpful just as an update of what's going on across the region and nationally, then again, that's the link for the regional Learning Disability and Autism team. Next slide, please. And then this, if you want to join the collaborative, you'd be very welcome. So if we can stop sharing now, thanks very much, Kim. I want to say thank you to all the speakers. They've been brilliant.